What exactly does SOC 2 certification say about, well, certainly about us or any other company that seeks that and achieves that certification?
Yeah, there's a few points to make about what it says. Use the word pass, and sometimes people treat it as a pass fail, but it's really not that. It's an opinion, and you're getting an opinion from a licensed professional who has a background and training in cybersecurity and compliance. And I'll just relate it to your field, the medical field. You can go to one physician and get an opinion about your medical condition and the state of that. You can go to another professional and get a different opinion. And there's a standard in the legal community called the reasonable man standard. And you're basically saying, will this professional who has this background, training, education, will they come to the same conclusion that this other professional will? And that's the standard for these audits. It's the reasonable assurance. Is what Mingle Health is saying and is what Mingle Health is doing, is it reasonable? And there's an opinion expressed about whether or not what you're doing is reasonable. And so, for example, if we come into an audit and we say, oh, wow, Dr. Mingle, you've got all of this patient data in your database and you're not encrypting the database. And this has happened, by the way, numerous times in my career. And the people will say, well, we don't feel that we need to encrypt that. It really slows down our system when we encrypt. And we really don't have any threats anyway. We've never had an attack. No one's ever stolen anything from us. And so we're just not going to encrypt that data. My opinion as a professional, very likely in that situation would be, that's not reasonable. In this day and age, with the attacks that we have, with the breaches that are occurring, you should encrypt that data that's at rest in that database that holds patient data. And so that would be my professional opinion. And so the opinion that would be expressed would be a qualified opinion that would say, this is not reasonable what this organization is doing by not encrypting. And so that's one thing that these reports express. It's an opinion from a professional, but also what's being communicated in the report is the criteria that you have undergone. The AICPA publishes this trust services criteria. And so there are these established things about security of the system and availability of the system, the confidentiality measures that you put into place in dealing with your customers, and then also processing integrity. And each organization puts controls in place to achieve the criteria. And so we're testing to see if those controls are indeed in place and if they have operated effectively over a period of time. And so that's really the core of the report, is explaining how we tested that and what the results were prior to expressing that opinion that I talked about.